Hello everyone, I'm Hideyuki Mimata, Research Center of Computational Mechanics, and also I'm working on joint research with Dr. Matsuura, Chiba University. I'd like to talk about the study on evaluation methods for the bone healing process after intramedullary nailing for femoral shaft fracture by assessing CT-based material properties to the callus as well as bone. Although intramedullary nailing for femoral shaft fracture has a good union rate, 3 to 12% of patients have non-union. These factors include mechanical ones, especially hypertrophic non-union are thought to be caused by fracture site instability. However, there is no established method for quantitative evaluation for postoperative instability, and no clear criteria for when to remove an intramedullary nail. For the mechanical evaluation of bone, quantitative CT-based finite element analysis (QCT-FEA) has been established since material properties were obtained from density value in cadaver experiments. After that, many high correlations with cadaver experiments has been reported. In the last year, the conversion equations for the material properties of the callus has been obtained, and now mechanical evaluation of the callus during the bone healing process is possible. The purpose of this study is to quantify the instability after intramedullary nailing and to evaluate the criteria for removal of intramedullary nails using finite element analysis. The subject, a 51-year-old man, was wounded in a fall while riding his motorbike when he collided with an oncoming automobile. He was taken by ambulance, and a fracture of the left femoral shaft was discovered. Striker T2 femoral nail, 11 mm in diameter and 360 mm in length, was used in an emergency operation. X-rays and CT images at 6 months after the surgery show that there was no continuity even though callus were formed, and there was concern about lack of fixation and the possibility of hypertrophic non-union. After that, bone healing progressed mainly on medial side, and at 15 months postoperatively, adequate healing was considered to be achieved. Here is the finite element model. The bone and callus geometry were segmented from CT data. The nail and screws were created with modeling software because the CT resolution was not enough for the details. In addition, to set the upper density limit, we modeled the artifact region separately for cancellous and cortical bone. The material properties of the nail and screws were given as titanium alloy. For bone and callus, inhomogeneous material properties were assigned according to the equations obtained in research at Chiba University. The upper density limit of the artifact region is set for cancellous bone and cortical bone respectively, based on the density distribution of the healthy side. Contact conditions are set between nail-to-bone callus and nail-to-screw with friction coefficient 0. For boundary conditions, the joint reaction force and muscle forces at maximum load during gait cycle were set according to the body weight. The distal end is constrained via a soft material mimicking cartilage to allow bone bending, and a single point on the femoral head was limited to move only in the mechanical axis direction. Here is the evaluation method. As shown before, the empirical formula gives also the inhomogeneous yield stress based on the density. The critical stress was assumed to be 0.8 times the yield stress as in the case of bone, and the tensile failure risk of the callus was evaluated. Furthermore, as shown in the figure, the volume ratio with tensile failure risk over 1 at the fracture site was used as an index. To evaluate the movement between the bone fragments, we measure the change in distance between the bone fragments before and after loading on the medial and lateral side. This slide shows how to evaluate bone strength with nail removed. We created models with nail removed virtually. A load cell was placed at the femoral head, and substator was placed at the distal end to allow bone bending. A material nonlinear analysis was performed, and the strength was determined by the peak value of the displacement load curve. Here is the result at 6 months postoperatively. The figure on the left shows element with tensile failure risk greater than 50%. The horizontal axis of the graph is the hip reaction force, and the vertical axis is tensile failure ratio. At the maximal load during gait cycle, more than 3 times the body weight was applied on the femoral head, and about 12% of the callus caused tensile failure. There is concern about non-union during gait. Similarly, here the result at 12 and 15 months postoperatively, the tensile failure risk of the callus decreased from the medial side with time, and at 15 months postoperatively, the risk was less than 1%. These graphs show the displacement of the proximal bone fragment relative to the distal bone fragment, showing the medial lateral, anterior posterior, and distal proximal respectively. The proximal fragment is medially rotated relative to the distal fragment, and the fragment gap is closed on the medial side and open on the lateral side. In addition, we can see that the movement of all of them decreased with time. These are failure elements of models with nail removed at 6, 12, and 15 months postoperatively. At 6 and 12 months postoperatively, failure elements occurred at fracture site, but at 15 months postoperatively, it occurred at the proximal site. The strength increased with time, and at 15 months postoperatively, it exceeded the strength of the healthy side. With regard to the tensile failure ratio, it decreased over time, which was consistent with the imaging findings indicating bone healing. This indicated the possibility of quantitative evaluation of bone healing progress. Furthermore, if the cutoff value or rate of change resulting in non-union can be obtained by increasing cases in the future, it is expected to be applied to the early diagnosis of non-union, early determination of revision surgery, and determination of the optimal surgical procedure preoperatively. Furthermore, if the risk of failure due to loading can be evaluated, it could be applied to rehabilitation. Early loading is usually recommended to improve bone healing due to vascularization and to prevent functional impairments such as muscle atrophy. For this purpose, a rehabilitation program tailored to each patient's situation is necessary. It is expected that finite element analysis can be used in rehabilitation to set up an optimal rehabilitation program that does not result in non-union. The displacement between the bone fragments shows a decrease from the medial side over time, and the tensile failure ratio also shows a decrease, especially on the medial side. These results suggest that bone healing is progressing from the medial side. On the lateral side, the gap between the bone fragment is open during loading, and the tensile force at the fracture site may prevent bone healing. Compression has been reported to be superior to tension and shear for revascularization and osteogenesis at fracture site in experiments using SIP, which is consistent with the present case. In femoral shaft fracture, tensile forces apply on the lateral side, considering the joint reaction forces and abductor muscles applied in daily activities. Therefore, lateral fixation may be important for early bone healing. This means that augmentation plating on the lateral side may be useful. The change in bone strength with nail removed exceeded the strength of the healthy side at 15 months postoperatively, and furthermore, fracture occurred at the proximal rather than at fracture site. So, it was considered possible to remove the nail. At present, the decision on nail removal depends on the subjective judgment of the doctor, such as image findings, but finite element analysis makes it possible to clarify the criteria for nail removal. In this study, we evaluated the degree of bone healing after intramedullary nailing for femoral shaft fracture in terms of callus failure risk, instability at the fracture site, and strength with the nail removed. Changes in the tensile failure ratio were consistent with imaging findings, which suggested the possibility of quantitative assessment of bone healing. If the cutoff value resulting in non-union can be obtained, it can be applied to the early diagnosis of non-union or early decision of revision surgery. In the strength analysis with virtually nail removed, it was shown that the criteria for nail removal could be clarified by finite element analysis. Now we are comparing the models for revision surgery, exchange nail, and augmentation plating. We'd like to show them at the next user meeting. Thank you for your attention.